Greetings and a warm welcome from the Premier Rehabilitation Center and Mental Illness Hospital in the Delhi NCR region. Today, we have a special treat for you all, as our founder, the renowned Dr. Gorav Gupta, takes the stage to shed light on a crucial and often overlooked issue, the destructive impact of alcohol and how to overcome it. So, sit back, relax, and be prepared to learn from one of the leading experts in the field.
Quite loudly, I think I'm audible to everybody. Yes, good. I see a lot of them who are very bored of our psychiatric presentations, and as such the psychiatry is never in a demand subject. But unfortunately after COVID the situation is very, very different. So psychiatrists are too much in demand and there are lack of psychiatry. So in England, recently I was seeing a patient and he had a 9-month waiting for an appointment, and that's why he flown to India for the psychiatric treatment. So we will get a lot of patients, and I think in hospital 10 to 15% of the patients has psychiatric problems. So I am Dr. Gorav and I am a psychiatrist, and I run the psychiatry department of Paras Hospital. Also, I manage that. This is under the purview of Tulsi Healthcare. Dr. Jiloha, Dr. Anil, Dr. Sonali are the ones who are here on behalf of Tulsi Healthcare, and we are trying to improve services. Unfortunately, in COVID, we could not do much. But we will start a lot of clinical interventions and other things which is going to be helpful for the department and overall Paras Healthcare. I also run a facility which is 100 bedded and is one of the biggest private facility in North India, in very close to this, that is in sector 64, and a lot of time we get patients who require a psychiatric inpatient care. So I think it would be worthwhile, because what we have seen in the movies has over the time changed a lot. And you won't believe, in last 1 year I have treated around 40 doctors. So among the doctors also mental illness is becoming very prevalent, especially after COVID. So there was this doctor who flown all the way from US, and this guy was a critical care expert, and he had seen so many deaths in COVID that he developed the psychosis himself. And a lot of them are abusing alcohol and multiple substances, so it's becoming very common for us to have the problem. And last few years we are seeing there is an increase in number of alcohol and related problems. So let me ask, so it's a very short presentation and I'm not going to bore you much. Do you feel alcohol is becoming a problem, and in clinical practice you see such patients?
Yeah.
So what kind of a situation you face? Sometimes you face a doctor who is drinking excessively and becoming a nuisance. Not? Okay.
Not yet.
So we get lot of doctors. We rarely get lot of doctors. So it's becoming kind of a, so we all, the doctors or mental health professionals can also themselves be addicted. So I have seen lot of doctors, rather my colleagues, becoming into the addiction. So addiction is becoming very prevalent and we all socially use, but a lot of time we end up into the trouble. Now, do you feel it is a choice or it is beyond our control? Any guesswork? It's a choice that we become an addict, or it's out of our control we become an addict?
The second option, sir.
Second option. Okay. Then why we keep giving this suggestion that if you want you can do something about it and not treating that? You understand my point of view? Say, we don't ask to get them treated, we tell them you can control on your own. If the second option is true, that means they require a proper treatment. We keep giving the suggestions that you can manage your drinking on your own. I have seen, yesterday only I was seeing a liver damaged patient who required a liver transplant. And at 10 bilirubin he is still drinking. And they are ready to do the transplant but helping him to overcome the drinking habit or disease, leading to clinically significant impairment or distress. If somebody is drinking and that is leading to clinically significant impairment or distress, then it's a problem and they need some attention. It's difficult to treat them. They have a very high relapse rate, but still they should get opportunity. Even the 30% success rate is not less. That's a lot. So, Dr. Srali was talking about it, but it's very simple screening questionnaire, and that is CAGE. Whether you want to cut down, you get annoyed if discussed about it, you feel guilty that you have overly done it, or ever you feel you require a eye-opener drink. So simply, out of 4, even 1 is present, that means you need some attention. Why it is treated like this disease? Because there are a lot of social boundaries which we are very rigid. Like we all behave, we are particular about time. Similarly, the social parameters are crossed. The psychological parameters, we are not thinking about our life, about our work or any other thing, but only concerned about the alcohol. So we get, I'm not sure we ever, but lot of us only keep thinking. Like a obesity patient keep thinking about how to eat more. Now similarly, if somebody who has a problem keeps thinking that how they can get more alcohol or where they will organize the alcohol, where it is hidden, how they will arrange the money and lot of such things. Now these are the 3 areas where our neurological system, nervous system of brain is affected. Is a prefrontal cortex, pleasure pathway and stress pathway. These are identified areas which is why it's disease, and maybe after some time we will have the PET scans that will clearly define that drinking has affected our brain or not. So the future is going to be like we diagnose cancer with the PET. We will also diagnose the activity of prefrontal cortex and diagnose whether this person is healed or not. And unfortunately in India we are not using that kind of a parameters, but in Western countries they are using. And recently I saw a patient who spent $5,000 to get such tests done. So it definitely affects the life, and the patient gets affected very badly, health, physically, psychologically, relationships get affected, work get affected, socially get affected, financially get affected, and spiritually they are not doing well. Now definitely I think all the doctors can manage medical and psychological problems. The prevalence and incidence of mental illness is so high that the number of psychiatrists are very few. Like we were comparing ourselves with the Western world, the number of psychiatrists are 10 times in UK and still they have 9 months waiting. We are fortunate in NCR, the number of psychiatrists are quite a lot and you get everyday appointment. So like if you want to consult a doctor, you get immediate appointment. For rehabilitation, there is a 1 year waiting in Canada. Now, in India, the situation is entirely different and somebody can go to a doctor. So now, all the Westerners are saying that the healthcare in India is one of the best. Do you all agree to this or not?
Partly.
Fully?
Partly.
Fully. Okay, my daughter is in Yale. There is a university called Yale, and I paid $1,800 for a year insurance. She developed COVID and she was coughing very badly, and I told her, why don't you go to emergency? Okay, so she called the medical emergency number and they said we can only see you after 3 weeks. The another child I know had a fracture, and for X-ray he got 6 weeks appointment. So we are doing much better. Here surgery can be done in a day. If I want to get my surgery done, even today I can get it done. So anyway, for the management, I think that medical professionals are equivalently handled and they can do much better than the psychiatrist, especially in terms of medically assisted detox. But definitely for the long-term recovery or remaining abstinent for long-term from alcohol, there is lot of therapy or the behavioral modification is required, where the mental health professionals do play important role. Unfortunately, psychological services is still available in the metros, but in periphery they are not available. And there are a lot of facilities which are treating such patients very badly. So, we have a bad name for such facilities. So, we can do detoxification with benzodiazepines, with the vitamin supplements. Lot of time we see and using anti-epileptics to detox them. These are the few medicines which are being used to prevent the relapse: naltrexone, disulfiram, baclofen and acamprol. These are commonly available, very economical and can be used. So, Dr. Nora Volkov is doing a lot of research in this, and she is the one who is using imagining for the de-addiction. Now she says it's a disease of free will. Now, what can do much to reduce the shame and stigma of drug addiction? That is where is the biggest issue. We all psychiatrists feel that we all are stigmatizing mental health issues, and I think it's a high time we all accept that there can be problem and there is possible solutions. Thank you. So I was having a very brief presentation. So I think we have to come forward and take help. That's the only thing I will say. So we are open if you have any questions.
Thank you, sir. Dr. Gorav. On behalf of the scientific committee, we would like to thank Dr. Gorav Gupta, Dr. Laha, Dr. Samani for presentation. Hope we have many more psychiatric presentations like this. Thank you very much. We invite you all for lunch.